Dennis Stanley here with Respiratory Sensei. Today we have a secret subject, pulmonary function testing. Wait a minute, before you stop this video, I know you probably don't want to be a PFT tech. That's the last thing on your mind. In fact, I know that because when I speak to groups of like 100 or more RTs and ask them to raise their hand if they want to be a PFT tech when they grow up, maybe one person raises their hand. So I already know that most respiratory therapists are not interested in pulmonary function testing. But here's the deal. Maybe you should want to be a PFT tech. It has a few advantages, so I want to talk about those and just give you a first lesson of a series on what you need to know for pulmonary function testing. Maybe you should want to be a PFT tech. One good thing about being a PFT tech is you have to realize that it doesn't mean you have to do it full time. And that means that you don't have to be the main PFT tech and be stuck in that box in that office the whole time. You can't just be a substitute. In fact, a lot of hospitals need a substitute PFT tech for when the main PFT tech guy is off that day. There's another reason too, and that is that it's in high demand. It's a lot easier to get a job when they know that, by the way, you know how to do pulmonary function testing. Keep in mind that it doesn't mean that you still don't have to learn their equipment, but it's easy. And the third reason relates to that. You do not have to know everything about every meaning of every lung volume and every test that you can do. The first thing you have to do to be a PFT tech is just have somebody show you how to do it with the patient, what buttons to push, how to make sure you got a good test, and it's pretty easy. And so follow along here if you're thinking, well, maybe I do have a PFT nerd inside me. You might. Then I'm going to do a series of videos to help you discover that. And today, in the next 5 minutes, we're just going to talk about basic lung volumes. So don't freak out. Just watch the video and think, can I get this? And you're going to think, yeah, I get this. All right. I'm Dennis Respiratory Sensei. Be sure to subscribe so you don't miss any of these videos. We'll see you in a minute. At its most basic form, there really are only 4 lung volumes. First is the volume that you're breathing right now, just in and out casually. This is called the tidal volume. The next volume is above the tidal volume, is called the inspiratory reserve volume, and that makes sense. And by the way, the best way to understand these volumes, I like to breathe them in and out. But so when you breathe in your tidal volume, can you breathe in more than just that? You can if you try, can't you? So you breathe in your tidal volume, and then if you try, you can breathe in even more. That's the inspiratory reserve volume you have in reserve if you want it. So the IRV, the inspiratory reserve volume, is what it's called. It's a reserve. It's in reserve because you don't need to take it all of the time. It's just there if you need it. And you do need it in cases where you start exercising or climbing a hill or going upstairs. That's when you start taking your inspiratory reserve volume above your normal tidal volume. Now, next, there is the volume just below the tidal volume. To get there, you must first relax and let out your tidal volume. But even after your tidal volume is exhaled, can't you blow out more if you try? Well, you can. That is the expiratory volume. That's the expiratory reserve volume that you have in reserve if you want to blow it out. And it is your expiratory reserve volume, or your ERV. That's what that's called. So there are the 3 volumes, but of course, didn't we mention that there were 4? We did, didn't we? It turns out that below your ERV, after you've blown out all the air that you can, even forcefully, there is a secret protected volume of air in the lungs. And this is the volume that you cannot blow out. It's called the residual volume, or the RV. This is the volume of gas that's important because you need to retain it, because this is what's keeping your alveoli from totally collapsing. So this is called the residual volume, or the RV. It's always in your lungs at the very base, and it's what's keeping your alveoli in your lungs open. And that's it. Yes, I know you've heard of other volumes like vital capacity and inspiratory capacity and functional residual capacity, FRC, and even total lung capacity, or TLC. But those volumes are nothing more than special names given to combinations of these 4 basic volumes. So let's look at 4 other volumes that are just groupings of the 4 basic volumes. So the first thing we'll look at is something called total lung capacity. And that's easy. It's everything everything. It's all four of them, and that makes sense because it's the total lung capacity. Second is all of the air that you can breathe in and blow out, and that's called vital capacity. Remember, of the four basic volumes, there's really only one that you cannot exhale, and that's RV. So vital capacity are all of the top three volumes. It just excludes the residual volume because you can't breathe that in and blow it out. So if you look at the maximum amount that you can breathe all the way in and then blow all of that out, that's going to be called vital capacity. It just includes the top three volumes. It excludes the RV. And then we have the inspiratory and expiratory summary volumes. Might be called these the reserve volumes. We have different names for these, but these are also easy if you think about it. So if you relax by resting and letting out your tidal volume, and then from there you take a breath in as deeply as you can, first you're accomplishing your tidal volume. That's going to be the first part, and then you're going to accomplish your inspiratory reserve volume, VT and IRV. And you can tell these are both inspiratory volumes. They're part of your inspiration. The summary of all of your inspiration volumes, those two, is called your inspiratory capacity, or the 𝗖𝐶. And finally, if we look at the expiratory side, the summary of those volumes below the tidal volume, that's going to be those that you're blowing out below the tidal volume. You breathe out your tidal volume by relaxing and letting it out. And then what do you have left in the lungs? Well, first you have your expiratory reserve volume. That's the expiration you have in reserve if you try to blow it out. But then you also have a volume that you can't really blow out at all, and that's called your RV, your residual volume. So the expiratory summary volumes, I call them expiratory. That's kind of a cheat because the RV you can't actually blow out. But together, those two volumes, this is called your functional residual capacity. And that's it. There's the whole map. That's the four basic volumes that you breathe in and out, and also the residual volume, plus the four combination volumes, the four names of the volumes that are combinations of these basic four.